Change your settings. All right. Good morning, good afternoon, good evening, depending on when and where you are watching this Facebook Live. This is the voice and the face of Dr. Tolu Olubinton, CEO, founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas. We're here again to do another Facebook Live discussing topics that help improve your quality and quantity of life because it's not just living long, it's living well too. So, yay. And today our topic would be Doc, how do I help my child be healthy and love their body? And we're going to be doing this with the amazing Dr. Noha Polack. Woohoo! Oh, thank you so much for being here. How are you?
I am well, thank you. And how are you?
I am good. It's Friday. I'm thankful it's Friday. I'm ready for it to be Friday. But I'm good. Thank you. Thank you for asking. So now, for those of you who are watching live, hashtag live. And for those of you who are watching replay, hashtag replay. Remember, this is shareable. So please share and like us and follow us so that way you get alerts when we're doing things like this. And if you have any topic you want us to discuss, you can also put that in the comment section. All right, let's go. Let's go ahead. All right, Doc. Can you introduce yourself to our viewers who will watch live and replay? Who are you and what do you do?
My name is Dr. Noha Polack. I'm a pediatrician. I've been practicing pediatrics in the Northeastern New Jersey, very close to New York City, since 1996. So I've been a pediatrician for a little over 26 years and loving it. Um, I've done all kinds of things in pediatrics, and recently I have been doing a lot of focusing on children's health and body image issues. And that's what I love to talk about. So I am now a speaker on said topic, in addition to being a pediatrician.
Awesome, Doc. I love what you do, and I'm glad we're having discussions about this because it's very critical how we help our kids through this phase on, loving their body. So, next question. So, my first question is this. Um, but no, before I go to the next question, actually, why do you do what you do? I always like to ask, so our guests have an idea, like why did you choose this field?
So I love pediatrics, honestly, because it's a happy field, right? The great majority of kids, once they get over their acute illness, they are so happy. I get so many hugs, Dr. Tolu. I love the hugs. I also love the fact that I get to see my patients, now that I've been in practice so many years, be parents. That is a pleasure to see. So the long-term relationships in pediatrics really drive me, to be honest.
Oh wow, that's amazing. So they're your kids, your kids then have kids and they come. Oh wow, love it.
Isn't it wonderful? Yep.
Yes,
Yep.
it is. Look at the glory on your face and the hugs. Oh, they make the day go by so quicker. So I'm very happy for you, and I'm glad that you do what you do. So my first question is this: I have someone who's asking, my child hates his or her body. What do I do, Doc? Like, how do I? You have a child who says, "Oh, I don't like the way I look," or maybe someone made a comment. What do you say to that parent who's listening?
So I want to start this conversation by taking ownership of what we health professionals as well as parents are responsible for. I own this as a health professional. I want to say that we've driven this conversation to a place where kids are worried more about how they look and their body shape than their health. So
Mm.
let's refocus that, right? Let's change it. As a parent, I know I want my kids to be healthy. It's not that I want them to be thin. So if I want them to be healthy, why am I talking about their weight, right? Why am I not talking about their health? As a practitioner, also as a pediatrician or a family doc or any clinician or even teacher, let us focus on children's health. So if your kids say to you, I hate the way I look, ask them how they feel, right? It's not just how you look that's important. And that's the message that as adults we really should be giving to our kids. They're listening, and sometimes what they hear is not what we said, right?
Mm.
So I have so many examples to tell you, and I'd love to do that about this. So if you are a parent or a teacher or a professional and you have someone in front of you who doesn't like their body,
Mhm.
change that conversation about how they feel when they go for a walk, how they feel when they run, what they feel when they're on the soccer field. Are they out of breath? And if they say, I don't feel healthy, then let's talk about how we can get you to be healthier. That's my opinion.
A very good and worthy opinion. I took some notes. Very, very important to shift the focus from how one looks to how one actually feels as far as health. Very, very important. And you made a point earlier about we have to be careful that what we're communicating is what we mean to communicate. It's not so the word choice is very, very important. So are they hearing what we mean to communicate? We want you to be healthy, not we need you to look a certain way. And if you don't, you're doomed. Okay. Very, very key. So thank you for that. And I like that you're also encouraging parents or those parents, teachers, those who have a say or influences in the lives of children, that we learn the verbiage of that. So this is good. Speak on, doc. Now, my next question is this: you have parents who come in who say, "My child is being teased and bullied at school due to their body shape, doc." Like, I get what you're saying. I don't mean to make my child feel bad. Um, but this is one of the reasons why I have those conversations that push, the whole weight issue. My child is being teased and bullied due to their body shape. What do I say to them to help them feel better? How can I help them?
So, first of all, let's refocus that, right? Is someone's opinion a fact, right? So, I like to talk to my patients about the difference between someone's opinions and someone's facts. And that's something that a kid at the age of 10 years old can understand. So I help them understand that just because this person called you this name or this thing or this adjective, it doesn't make it a fact, right? So, in your own mind, understand that opinions are not facts, number one. And number two is, as a parent, you are your child's hero. If you act as their hero, if you say to them, that person is simply wrong, you are not this. I want you to be healthy. Let's get you to a healthy place. A lot of parents come into the practice and say to me, Doc, my kid is being teased about their health, about their weight.
Great.
They're being teased about their shape. How do I help them lose weight? And I said, hold on a minute. That's not what we want to do. We want our kids to be healthy. And we don't want to say to them, because this kid teased you, I want to help you lose weight. That means that other bully is right. But no, if you are your child's hero, you will say, I love the way you are. And if you want to be healthier, let's do it together. And what this person said is an irrelevant opinion, it is not a fact.
Wow, you just dropped some gems that I'm trying to document right here. Very, very, very important. And hi, Dr. Una, thanks for watching. Um, we got to act as your hero, and we have to be careful not to validate the point or the point from the bully standpoint. That is big. So you come home, oh, someone made fun of me because you say, okay, well, we got to help you lose weight, and they're like, oh, they're right, and so we're sending the wrong message unknowingly. And this is not a make you feel bad as a parent, as a teacher, as a physician. It's we're having this discussion so we're empowered to empower our parents, and our children. So don't feel guilty if you're watching this. I'm taking notes because I'm guilty of the same thing. All right. So really important that we act as our kids' hero and we do not validate the points that the bullies are saying, and we emphasize health over the non-fact. So differentiate fact versus opinion. I love you, Dr. Noah. Thank you. This is great. All right. Next question. All right, so you have a doctor who's watching this or who watched this in replay, or I work with, I'm a child psychologist. I work with parents and their kids. How can I talk to my patients about their health and weight without causing them inadvertently to hate their body? Because I believe no one would do that intentionally.
Wow, that's a really great question, Dr. Tolu. Thank you. So, I would like to say first, once again, refocus the conversation from body shape to health, and then go into the idea of, the three main things that make us healthy are nutrition, movement, and mindset. So, you can take one, but you don't need to take all three of them at the same time and act on them, because no one can act on everything simultaneously. Talk
Mm.
to your child about, those are the three things that we can do to help you get healthier. Where do you want to start? Ask them. Don't make the decision for them, right? A kid at the age of 7 or 8 can tell you, Mom, I really hate vegetables and I just don't want to do that. Okay, that's fine. Let's talk about movement. Okay? Stay with the diet we have now, but you as a parent also have a lot of control over the nutrition of your child. But you can say to them, okay, well, let's start to get healthier by moving more. Don't call it exercise. Kids sometimes get turned off so quickly by that word. Let's move more. So, Mom, what are we going to do to move? Here in the Northeast, it's so cold right now. I don't want to be outside. All
Mm.
right, that's fine. Let's have a dance party every night after dinner. 15-minute dance party. Turn on the music and move your body. Okay, Mom, I hate to dance. Fine, let's buy you a hula hoop. Do you want a hula hoop or a jump rope? Pick one. Okay, let's do it together. Let's watch a movement video. Let's buy a video game that makes you move. There's so many ways you can help your child be healthy without making it really overly burdensome for them.
I, I'm laughing because I'm so happy. I almost think this is for me. The hula hoop, like, give them the option to decide, to make choices. It empowers them, and it also builds their confidence. So this is awesome, and I love the dance party idea. Um, and and you mentioned something about we having the control as far as nutrition. We can have a variety of options available to them, veggies hidden in a different snack on a different format, and say, hey, you have options. You could pick this, you could pick that, but have healthy options for them to choose from. That way, indirectly, we help influence or guide their decisions. This is good. Now, you said mindset, you said nutrition. We talked about that. You said movement. You said mindset. Sometimes I have to say it can seem like a daunting challenge or a daunting task for us to imbibe such mindsets. What are ways we can passively do that or actively do that? I don't know if that question makes sense. Like, how do we do that? You know, give us tips, Doc. That's essentially what I'm
So
asking.
let's first acknowledge when this big mindset shift in how people think about their body happened. In the 1980s, we started to notice a sudden rise in weight, right? In obesity, both in adults and in children. So the medical establishment started to talk about overweight, obese, and then diet culture came about.
Mm,
Diet culture came about, and now it's all about losing weight, hurry up and lose weight. But losing weight doesn't necessarily mean you're healthy, right?
true.
So that's where our mindset shift really needs to happen, in my opinion, at this point, especially for the really vulnerable population of preteens and teens, because we are setting them up for life as parents. So again, their mindset should focus on what I can do versus what I cannot do. So, what can your child do today, right? Can they walk 10 minutes? Amazing. Make them feel good about it and see if they want to do 15 minutes. Do they play 2 hours of soccer on the soccer field, but they're their slowest because they have a few extra pounds? Okay, that's fine. They can still run around for 2 hours. Make them feel good about what they are able to do. I think that if we help our children feel good about their capabilities, then we will be enabling them to love their body and treat it better. You see, if you love something, you will treat it well. And treating your body well means eating nutritious foods as often as possible and moving more. So that's where I think we, both professionals and parents, should really refocus. What can you do? Love it, encourage them until they feel well enough to make a small change. And, as our mentor says, Dr. Tolu, little tiny changes every day add up. Imagine what can happen in 10 years. And if you're dealing with a child, imagine what can happen in 50, 60 years.
Hmm. Hmm. Man, I'm so pumped, man. This is so good. You said make them feel good about what they're able to do. It's not to, overly what was the word, like psychophants, to overly say, oh yeah, this is you can do this, and or what's the word? is not to pretend or act like they can do something that they cannot. It's focusing and finding those things that they're good at and encouraging them in that. It makes them feel good about their capabilities, and then it helps them love their body. And when you love your body, you take care of it. That is gold. All right, Doc, I love it. Now, my next question. So you have a child who says, you know what? I understand movement. I'm doing that. Mindset, I'm still working on that. Nutrition, I'm still doing that. But your child has said they're old enough to say, I want to lose weight. What's the next step? And they're
So
saying,
then,
what do you say?
right. I mean, honestly, the next step is to go to your pediatrician, right? Right. Who are your resources? Ask your child, who are you comfortable talking to about this issue? So, for example, if your pediatrician, has an interest in helping your child be healthy, go to them. If not, then find someone in your community who has that interest, or find online resources that are specific for children and that do not focus on restriction. Dr. Tolu, this is a huge message I want to give to parents. We should not be restricting our kids' intake for them, okay? Let us offer them nutritious, healthy foods most of the time. Allow them to have something that is less healthy some of the time, and don't overly restrict. Be careful of diet culture. I believe that some of our children have developed eating disorders because of some of the messages we are giving, to be honest. And let us refocus on that. I have had experiences in my practice where a patient comes in and says, Doc, I only eat 2 meals a day. Why, child? Why are you not eating your 3 meals a day? Because you told me I should eat less 3 years ago. And I'm like, whoop,
Mm.
my bad. I should not have said that. I apologize to the child and the parent, and I refocus the conversation on health. I want help people understand that it's okay to be vulnerable as a provider, as a parent, as a teacher. Say, "Oh my goodness, that was the wrong thing to say. I have changed since then. Forgive me. You need to eat your 3 meals a day. You need to have your nutrition. And if you're at a party and you really want a piece of cake, child, eat it,
Mm.
right? So help your child to be healthy by finding the right healthy resources that will not just help their body, but help their mindset.
Wow. Thank you so much, Dr. Noah. I really appreciate this. And you mentioned, I mean, a lot of gems, but one of the things I wanted to highlight, look for someone who can help your child. Want it to be a pediatrician, yes, but sometimes you may have to look online, you may have to watch videos like this, and look for someone who can help empower your child. So sometimes it takes a lot of, it takes more effort, but be conscious to make sure that you have someone who doesn't emphasize overly restrictions. So that's big. And okay to be vulnerable. I love that. I'm sorry. I thought that was right at the time. And now we're rethinking this whole thing. So we're having conversations in line with that. All right. So finally, I was gonna ask in summary. So I have a parent who's watching who's saying, "Wow, this is good. This is great. I love this." Well, what would you say to the parent who's like, "I feel really bad that I have done some of the things that you said not to do, and I'm a little worried that the damage may be done." What would you say to that parent to encourage them to say, there's hope? How would you say that, Doc?
So I would say, first of all, um, we all evolve. Our mindset evolves. The information we're given by the medical community and everything around us also evolves. Help your child understand that information is not static,
Mm.
right? Science, by definition, is about trial and error and trial and error. That's what science is. So I do not feel bad when I say to my patients, I thought that was okay, but I've learned better. And I am thinking that this is a better way of doing it. So parents, don't feel guilty. You did your best with the information you had at the time. And
Mm.
so did I. And so did we all. However, if you know different information now, rather than feeling bad about it, go ahead and move forward with the positive messaging that you have now. And once again, being vulnerable, I find children are so forgiving. It's so amazing,
Mhm.
right? I'm sure you know this, Dr. Tolo. You have children,
Yeah.
right? And sometimes you make a mistake and you're like, oh my goodness, I'm so sorry. And they give you a hug,
Yep.
right? You're teaching them it's okay to make a mistake, it's okay to own it, and it's okay to forgive. What a huge message.
Wow. Yeah, we're gonna do another one of these, by the way. Dr. Paula, we gotta do this is great. Information evolves, and no matter the age, anyone can change. You change their mindset, you change their life. So don't give up. You repent, forgive yourself, forgive others. That's what I tell people, and then you move on. So this has been great. So I have people who are watching who are like, Doc, where can I connect with this doctor? I like her. I want her to come speak on my platforms. I want to invite her to my group to come empower and enlighten the parents. Where can people find you, Doc?
Oh my goodness, thank you for asking. So, I would love to speak on all kinds of different platforms, but I have a website. It's Dr. Polack, drpolack.com. If you'd like to reach out, I would love to have a conversation with you. Also, I'm on LinkedIn. If you could find me, it's under Noha Polack. And I would love to have a conversation about all kinds of educational experiences for parents and professionals.
Awesome, awesome. This is good. Thank you. Ah! All right. For those who are watching, thank you for joining. Thank you for hanging out with us. Please tag your friends forward, subscribe so you can also get notifications when we go live. And if you or anyone you know is looking for an awesome, a passionate family physician in the Mansfield, Texas area who helps empower kids also to live their best lives, I am she. Have a good one. Thank you so much, Doc. You rock. All right.